Welcome to the NICU. You probably didn't envision your baby's first days of life here. NICU Nook will help you understand what's going on in the NICU so that you can feel more comfortable. What is the NICU? The NICU is an intensive care unit for both preterm and full-term infants with specialized medical needs. Your baby is exactly where they need to be right now, and you are the best person to care for them throughout this experience.
We hear this a lot from NICU parents. You may also be asking yourself, who else is in the same boat as me? Humans tend to feel reassured when we know we're not alone. This is normal. Between 10 and 15% of all babies in the US require special care in the NICU.
Some of you may have known ahead of time that your baby would be in the NICU, while for others it was a complete surprise. There isn't one type of NICU baby. Since being in your NICU, you may have looked around at your neighbors and have seen babies that look like your baby and some others that don't. It's normal to be curious about the other babies, and it's normal to feel envious, uncertain, sad, and many other emotions. There are so many reasons babies are in the NICU. Here are just a few.
Let's talk about reasons pre-delivery. Your baby may have been born prematurely. Something was found on your prenatal ultrasound that now requires special follow-up. Your baby may have been born small for their gestational age. Or there was an unexpected genetic finding. Or maybe none of these apply to you.
Let's talk about reasons during delivery. If you had a fever, your baby may be in the NICU just for a few days to receive antibiotics. Your baby may have had a low APGAR score, which means that they needed extra help to transition from the womb. This can result from prematurity, placenta problems like placenta abruption or previa, meconium aspiration, nuchal cord, or for unknown reasons.
Let's talk about reasons after birth. It's possible that your baby was initially in the newborn nursery and was sent to the NICU for reasons like low blood sugar, feeding, or breathing concerns. Whatever the reason is that your baby is in the NICU, know that it is not your fault. Unfortunately, you can't change what happened during pregnancy, delivery, or after birth that resulted in your baby's NICU stay. However, you do have the power to affect your baby's next steps. The NICU may be part of your story, but it does not define you or your baby. Further along in NICU Nook, we'll talk about common feelings in NICU parents and how to manage more difficult emotions.
Who would have thought your baby would have so many different people caring for them in their first few days of life? First, your baby has a nurse. A NICU nurse is a registered nurse that has specialized training to care for babies just like yours. A nurse is with your baby 24/7. Typically, your baby will have 2 nurses per day, a night shift and a day shift nurse. The nurses are your eyes and ears when you're not at bedside. They monitor your baby's health and communicate updates with your team of doctors. There may be nurses that you feel more at ease with and that you get along with most, or with whom you have similar communication styles. Many NICUs allow you to choose a primary nurse, which means that your primary nurse is present. They will take care of your baby. This can provide continuity of care, though it isn't a must. If you'd like to choose a primary nurse, ask them directly. It may or may not be possible, but it's worth asking.
The rest of your baby's medical team is comprehensive. Residents are medical doctors who have graduated from medical school and are completing several years of advanced training in pediatrics. Fellows have completed their pediatric residencies and are getting even more specialized training in neonatology. Attendings have done all of that already. They are in charge of your baby's care team. There are also nurse practitioners and physician assistants. These are advanced practice providers with a master's or doctoral degree who may also lead your baby's care team.
Every baby in the NICU has different needs, but you can rest assured that your NICU team will meet all of them. There are occupational therapists, speech therapists, physical therapists, respiratory therapists, social workers, nutritionists, lactation consultants, chaplains, and occasionally clinical psychologists. Everyone on your baby's care team helps one another, and they need one another.